The Minister of Health has dismissed the reports about the closure of HIV clinics following an interruption in funding from the U.S. government that has been aiding a number of health programs, including HIV. The Permanent Secretary, Minister of Health, Dr. Atwine, reaffirms that HIV services have been integrated with other specialized clinics at all government health facilities. This clarification follows an earlier report by one of the dailies stating that government intends to close HIV clinics.
What we are saying is that the clinics that will have been running HIV as standalone must be integrated with some other clinics. For example, today I was in Kayunga. I went there and I wanted to see how integration is being done. And it is a very excellent way of doing that. Because now that whole, the doctors that see hypertension, diabetes, they can also see HIV. They have designated their special days. HIV will come, but they will sit where also other people are getting services from. And so it is not really that, it is not true that people are going to be that clinics are phased out. It is not true. We are simply saying that we are saying that doctors that were seeing other chronic illnesses like diabetes, like hypertension, will be also seeing the patients of HIV. That's all. That's what this message is meaning. Instead of having a separate place that, this one is only for HIV, no one is supposed to go. Because
Dr. Atwine stresses that the integration of HIV services will not compromise the quality of care.
Actually, by integrating, you are removing stigma. Because if I come and I have HIV and I'm seated with hypertension, how will you know me? But if I go and sit to the other side and I sit in the other shade and everyone knows that that is for HIV. Actually, that is more stigmatizing than if I come and I sit with everybody. I enter the room, I see the doctor checks me, gives me prescription, I go and pick my medicine. I don't see any stigmatization of that. It is not also compromising. This integration is not compromising the standards of care at all. Actually, it is improving the standard of care, because we are now saying even the special, because in most of these clinics, the people who would see in HIV people, they are just medical officers, junior people, even nurses. But we are saying, no, this time you must come and be seen by the doctor in our clinic, like how other people are seen.
According to the Minister of Health, government has been allocating 50 billion Uganda shillings annually for ARVs, but this will now be revised to ensure that all HIV services are not affected. Adia Nakote, UBC.